thank you for inviting me here. Thank you for the invitation. I'm co-founder of Kinderen with Long COVID in the Netherlands. I'm working as a psychologist full-time at Arbonet. And otherwise, I also have a mother of three children, and the youngest two are doing with long COVID since 2020. So I have different roles here. But I'll take you on a short journey from the last 4 or 5 years. And it's not only my story, it's also the story of all the other children and all the other parents struggling with the same things. And I feel honored that I can spread the word from all of them here right now. Let's start with introducing my children. They are the main reason I'm standing here. We go back in time, it's 2020. This is August and this is November. And these were the children before they get sick. They were 11 and 7 years old at that moment. As you can see, they're full of energy. My son was playing football in the first team of his football club, playing outside, full of energy, no problems at all. And my daughter, she was always happy, playing and enjoying life. And then came December 2020, and COVID came into our house. And at the first time we thought, oh yes, we have it because children were not vulnerable. It was okay for them to get COVID, so you can go on. It's good for their immune system. So we thought, okay, we've got it. But it was the beginning of a real nightmare because they never recovered from it. And these are the children right now. My son, now 15 years old, is fully housebound. He cannot attend to school anymore. He can only go outside for once in 3 months to see someone or to go to a film or a movie. We have done a lot of tests at the hospital. Most of the things came back normal as we used to have long COVID. We know he had PEM pulse, you know. And the only thing we can do right now is just pacing. And pacing means sleep, rest, 45 minutes online school per day, just one subject. Was it? Subject. Oh, one subject. And that's all you can. And my daughter, she has now a baseline of 50%, I guess. So she goes half days to school, and the rest of the time she's at home. So our lives fully, is fully different as it was before, and it's hard to see your children fighting. And I will take you to the hard facts. So I go and here it is. Just like the hard fact, because my children are not the only ones. When we go to the most conservative estimation, it's about 1-2% of the children who got COVID who get long COVID. And we talking about a minimum of around 3,000 children. Can you imagine? And it's only in the Netherlands. From the children from COVID, the patient group, we only see, I think, between 1,000 and 2,000 families. So where's the rest? And that's what worries us the most, because a lot of children are dealing with long COVID from mild to severe, and they're not visible. They get other diagnoses, psychological diagnoses like anxiety, depression, or CVS, or post-viral tiredness, or something like that. And that's really worrying us a lot. About 2 children per school class. And then when I look at the school of my children, they're the only ones. Nothing. There must be more. What most people not know here in the Netherlands is that even children get long COVID, even after 5 years now, they don't know, and even after asymptomatic. Sorry for my not really well. It's my first time. Okay. We have been struggling the past few years, and all the parents I spoke to are struggling also because there's a lack of knowledge with every authorities. at school, how the family doctor, the pediatricians, work at another work at all. No one knows exactly what long COVID is, and so I have to educate every time I see a professional, healthcare professional, or someone at school. I have to educate them about what's happening and what's going on with my children. Um, you, yeah, when your children are ill in the Netherlands and they cannot attend to school, you have to do a lot of conversations with a lot of healthcare professionals, a lot of professionals at school, because they say children has to be at school, even if they're sick. But when school is making them more severe sick, they don't listen. So you have to fight against all those authorities, fight for the health of your own child. And that's really, really difficult. Um, Another thing is also that you cannot prevent your child for another B infection, because at school there's no testing anymore. Everyone comes to school, even if they have a cold. Um, so it's like a Russian roulette. So you take your children, but maybe you get them sick then. And the psychologisation in the Netherlands with children is really a big topic at the moment right now, because the biopsychological model in children is a big thing, because children are developing, they need to see friends, they need to see it has to be at school, even if it's not possible. And when you as a parent says, no, I don't want to go because I want to protect my child, then you can get sometimes struggle with the safety at home services. Or they're forcing you to do things you don't want to do or what's not helping the child. And in the Netherlands, the doctors will nothing, just the basic blood tests, and that's all. There are no treatment trials or studies. They're coming, but right now there's nothing. So you have to just wait and hope for better days. Now, the underdiagnosis we're talking about, this is a quote just recently. We told a parent on COVID does not exist. The recognition of PEM, so facing not the pushing is constantly going on right now. And the other thing is that when the blood tests came back normal, they cannot find anything. They say, okay, the child has a depression or an anxiety disorder, and maybe you as a parent are a sustaining factor, and the reason why the child is still ill. Now the social gaps, getting help from social institutions or appropriate education is really difficult, because online education is not the normal thing. Before the summer last year, it was around May 23. I had to do a real battle with school to get my son online lessons, because he wants to, just 30 minutes a day, and they wouldn't pay it. So I really battled to arrange it. And you have to do that next to your job, next to your informal care, all the things together. So yeah, it's amazing. The child protection services. And when the child gets 18 in the Netherlands, then you have to go to the UWV to get some life money for your child. And that's even not possible, because maybe they can get better in their lives. So that means that when your child is 18, you won't get any money, and the parents have to take care of them. But they cannot live on their own because they have no money and no school, no exams. So they're isolated. were not visible anymore at that time. That's what I said. Also, this also the wrong diagnosis is a real big problem. The guidelines are really outdated, and the guidelines which are there are just like psychosocial, psychologists, physiotherapists, ergotherapists, and that's all they say. Nothing biomedical. We have a little light point down there because today the first expert clinics in the Netherlands will start. We really worked hard on that to get it. It's a first step. We're not there because in the Netherlands, the whole ethical system is really difficult for children. So before we can treat children with off-label medication or other things like that, it has to be proven and adults, so it's safe. And that's real great. But yeah, it's a difficult thing. If the kids are real suffering and we cannot wait for 10 years to get the treatment of the kids because then they're grown up and they cannot do anything. So we still keep fighting for children. The expert centers will come. And we hope that after 2 years there will be new updated guidelines so we can disseminate the knowledge to other healthcare professionals. The support care must be easier to access to support parents in the care and take care of their children because now it's really hard. And most people who get there are highly educated people. Sometimes I say the people we see as the patients group are white children from highly educated parents. It hurts me to say, but all the others are, I don't know where they are. And yeah, it's heartbreaking. And I hope that the child protection services will improve their knowledge because stop with doing those reports. It's more stressful and it's not helping the families, children. Well, we do a lot. We do providing information for parents, support care groups. We do advocacy, lobbying, and politics. We focus on more attention on prevention because we all know that it's an accumulating risk to get COVID over again. Children cannot prevent themselves for reinfection. So the group of children who suffering with long COVID is growing, and it must stop. We cannot accept it. And so we fight for it. And I think that's the